Hi, Christian Manietta here from Trigger Point Performance Therapy Australia. This week I'm going to talk about ITB pain and how to get rid of it. I know about this little beauty because I've suffered from it in both legs, and thankfully it's a thing of the distant past. The first thing you need to understand about overuse injuries is that our body's activities are an interrelated process. So to get rid of the pain symptoms, we must heal the body's biomechanical challenges. We believe overuse injuries start in the soleus. It binds up due to activity, how we sit, the shoe choices we use. We actually lose the ability to dorsiflect the foot because our tibia anterior gets tight and overworked. This actually draws the knee forward, causing a lot of tension in the quads, TFL, psoas, which is a really big thick muscle that connects all the way up to the inside of the spine on the T12. And the result of this compression in L4, L5 and sacroiliac joint is what causes your pelvis to tilt. Think of your pelvis this way. Think of it as a bucket of water that's filled. Now when our pelvis tilts forward anteriorly, think about the water pouring out the front. What happens now is our QL, or our lower back, actually tightens up, and our ITB and hamstrings are lengthened past capacity. Kind of feel like overtension guitar strings. If you stretch now, that's just going to make the problem worse. So even though the ITB refers to a band of fascia, it's important to understand and recognize that the entire chain, your calves, your quads, your psoas, your TFL, your glutes, they're all connected. Alright, and this influences what the ITB does. So let's go and fix it. First, let's look at the way you sit. Sitting with your legs tucked under you, on your tippy toes, is just compounding the problems by binding up your soleus, calf, and post-tib, shin. This is the starting point to your biomechanical dysfunction and ITB pain. We want to look at and treat the whole biomechanical chain. We start with the soleus, post-tib, flexors and extensors, which are all muscles in the calf. Then we quickly hit the anterior tib too. This is the muscle on the shin. Quads, we want to attack them all. You do not have to continually hammer the symptom, i.e. the ITB. We don't just want to jam the hell out of it because it's not going to help. When your ITB gets tight, your adductors will too. So let's roll these. Now we also want to get into your TFL, your glutes, especially glute medius and piriformis. Also, as I mentioned before, the psoas. It's a big, thick muscle that plays a significant role around the hips and lower back. When we constantly look after these areas, we fix the ITB problems. Some of these treatments are not going to be fun. I won't lie to you. There's going to be a lot of sensitivity at first. It's going to take time. Sure, you're going to see some great instantaneous relief, but you need just to manipulate these areas I just showed you, relax, breathe deeply, let the tools do their work, stay active and hydrated, and give it time. The injuries didn't come up overnight, so they're not going to go away overnight. Take action now, and together we can fix this.